Okay, it should be good.
Alrighty. First, I'd like to welcome everyone to the Health and Social Services Committee meeting. Our minutes were, I'm sure, on the web page, and I read them, and I'd like to know if everybody else would like to make a motion to accept them.
Make a motion to accept the minutes of the Health and Social Services Committee.
Great, and I second it. Terrific. Alrighty, I'd like the two people who, one is from the nurses from Jacoby, and the other is from the domestic workers. The domestic workers will go first, and I would like each of them to introduce themselves and tell us why they're here. Okay?
Yes, Sandra, thank you so much. But yeah, I'm Reina Ravina.
I think you need to talk a little bit louder.
I'm from the Department of Consumer and Worker Protection. I am a community affairs associate that covers the Upper Manhattan and Bronx. So thank you for having me, and I'm excited to be here.
Great. And from the nurses, is it Miss Rendon? Who is, hello?
I don't see her.
I don't know what happened.
I think it's Vanessa Weldon that you're the name.
Yes, Vanessa.
Yeah, she's here.
Yes.
All right.
Can
go
you
ahead,
hear
Vanessa.
me? Okay.
Now we can, yes.
Okay, sorry. My name is Vanessa Weldon. I'm a home care nurse at Montefiore Benear for the last 22 years, be 23 years, and I'm the chairperson for NISNA. And we're here just to talk about the care that the community is receiving from Montefiore Home Care, in particular, the Nurse Family Partnership Program.
Oh, great. All right, so we'll let
Mhm.
so we'll let Rena go first.
Okay.
I hope I'm pronouncing it correctly. I'm not Rena, I'm sorry. Miss Rondon
I don't see her.
from the domestic workers.
Yes, hi. This is Reina.
Reina, I'm sorry.
Yes. No, you're good. So yeah, I'm here to present on our outreach efforts right now about domestic worker and what we've have available as a resource. And I have a presentation that
And you will explain what domestic workers, how you view them and who they are.
Yes, I will.
Great. Are you ready?
Can everybody see this?
Oh,
Now
I got
it.
it.
Now we got it.
All right. So, hi everyone. Thank you so much for having me present on this. My name is Reina. I'm a community affairs associate, like I mentioned, and I am the lead for this outreach efforts. And yeah, I'll be your presenter today. I'll be happy to take any questions after the presentation. And if I'm not able to answer any particular question, I'll be sure to take them down and your information and follow up with you after the presentation. So again, thank you so much for having me and let's get started. So moving into today's presentation, I'm just want to give you a little introduction to our agency. It's Department of Consumer and Worker Protection. This is our mission, which is to protect and enhance the daily economic lives of New Yorkers to create thriving communities. And what does that mean exactly? And because we also like to inform people, specifically the economic part, because if you were hurt by a business, let's say physically, that might not be under our jurisdiction, but if you were scammed by a business, that could be under our jurisdiction. So again, we just want to make sure that everyone knows what we do. And we also license more than 45,000 businesses in New York City, like your car washes, tobacco shops, and used car dealership. and to make sure that these businesses are not taking advantage of our city's consumers in the marketplace. We also enforce workplace rights, like your right to take a sick day or to take care of yourself or your loved ones, uh, and not be punished for that, and to ensure that we have a healthy workplace. And we also offer financial empowerment resources to help support your financial health, such as a one-on-one financial counseling or a free tax prep to help you with your taxes every year. And so in our agency, there is a specific division called the Paid Care Division dedicated to defending the rights of paid care worker or domestic worker, more colloquial, such as home health aides, personal care aides, home attendants, nannies, caregivers, and house cleaners. The department enforces key protection for these workers, such as a paid safe and sick leave. And in our complaint intake, we can actually help them with referrals to other workplace violation at the state and federal level. We also perform research and advocacy to improve the quality of life of these jobs and strengthen and just the advocacy for the system. Some key facts to know about the industry is that we know that the workers tend to be women of color and or immigrants. Many of the paid care workers are home health aides, but many are also house cleaners or nannies. And a key part of our work is that we make sure we work closely with our partner organization and are really responsive to the most vulnerable New Yorkers in today's workforce. And when we work with our partners to help educate these workers, we also seek to promote their strength and in an industry where workers are very much isolated. And our goal is to learn about the serious issues affecting their lives in order to help guide our work at the agency. And a key protection that is available in New York City is the paid safe and sick leave law. Under our agency, this law ensures that workers have a right to use sick leave for illness or medical care, such as routine checkup. Sick leave can also be used to take care of your family, for family members, or to take them to the doctor. Workers have a right to use also a safe leave in situation of domestic violence, for example, to move, to get legal service, or file a police report. And many of those absences, work related to domestic violence, are covered. Victims of other crimes like sexual assault, stalking, and trafficking can also use safe leave under New York City law. And under this law, employers of domestic workers must provide up to 40 hours or 5 days of paid leave each calendar year. Employers with 100 or more domestic workers, like a home health agency, must provide up to 56 hours paid leave. And other things to keep in mind is that it is to be accrued, so there is no waiting time. They can use it to for unexpected reason without giving advance notice. And your employer cannot punish or discipline you for taking your time. And if they try to retaliate in any kind, you should let us know. I can provide you with my information afterwards. But again, that is a form of retaliation and that is not allowed. And since the start of our enforcement, we have really secured more than 13 million in restitution for more than 43,000 workers who have brought these complaints to our office. This is one of the agency's cornerstone protection for New York City workers, And we want to hear from you if you have complaints about employers restricting or violating your access to this right. And one of the reasons why I'm here is that there is this new program called the Domestic Worker Mediation Program. And this is our new way of thinking and creative means to really make sure that we can help the workers who have disputes with their employers. So this past December, we also announced this program for domestic workers and their employers to resolve workplace issues in a respectful and confidential manner without needing to go to court. So this is a voluntary and free program. And so once again, that means that you don't have to do it if you don't want to. And at every step, we will guide the workers through. As you can see, the first step is that domestic worker contacts us because in a previously conducted study of domestic workers, we found that at least half of the paid care workforce, the majority who are immigrants and women of color, have experienced exploitations, such as wage theft, or paid safe and sick leave violation, harassment, discrimination, retaliation. This program will provide an accessible forum for workers to access their rights in a supportive environment and resolve their issues with their employers without the expense of any kind of adversarial nature, like going to court litigation. In terms of process, so should someone have a complaint, you would have to like us to bring to mediation. Our department team member will schedule an interview with you to identify the issue, inform you of all your rights and obligation, collect any relevant information and documents, and help them decide if this is the right path for you. So if all parties agree, then an attorney, a paid care attorney, will reach out to the employer about the case and the purpose and propose mediation. And again, these are all voluntary. If both worker and employer agree, a neutral mediator from the OAT office will work with the worker and employer to understand the issues and reach an agreement that is fair for everyone. And furthermore, this is a one on the back end, which is the consumer protection side, that if you were employed through an employment agency, you have a right as a consumer in New York City. Just as a best practice, make sure that you are using a licensed employment agency, which is providing you with all the appropriate documentation. They should give you a contract, receipts, and statements of your rights. You have a right to earn at least minimum wage at any job. An employment agency refers you. You have a right to a copy of your contract. Do not sign the contract if you do not understand it. You have a right to refuse to pay illegal fees. They cannot charge you a fee to schedule an interview, to refer you to another agency, and any additional items such as resume review or training courses. And you have a right to also file a complaint regardless of your immigration status. And that's also what I forgot to mention, is that our mediation program does not ask for any kind of immigration status. Therefore, if you know anyone that is hesitant, that does not come into any of our investigation. And finally, you have a right to be free from discrimination within all our programs. And so this is our outreach effort, and the International Domestic Workers Day is coming up in June 16. So as I mentioned earlier, outreach is an essential component to really support the workers. We work with our partners to help organize and helping promote, particularly in an industry where it is harder to really get um, contact with. But we attend meetings and to bring information like this directly to you. We're also conducting canvassing in parks, libraries, and other sites where we can meet the workers where they are. And we have collaborative with relationships with key organizations such as uh, National Domestic Workers Alliance, Carroll Gardens Association, and so much more. So if you have an event you'd like to join, we'd love to. Please share any kind of information to me, and we can certainly help follow that along. And yeah, and there is also a big event upcoming this July that is a convening of all our partner organization. And if you'd like for more information, you can contact me. And yeah, and if there's any question, I'd be happy to answer. This is our contact information with 311. This is our website, nyc.gov/DCWP. And Jeremy has all my information as well. But I'd be happy to write down any kind of other information that you might need from me. Thank you so much.
Thank you. Is there anyone who has a question for Raina?
Hi, Sandy. It's me, Cynthia. I do have
Go ahead.
two questions. One, I believe if I'm not mistaken, we may actually have posted some flyers on our social media for the mediation program. So that's awesome.
Thank you so much for that.
We would love it if you could forward us the PowerPoints. Give me 1 second, please. Sorry. How can I help you? Sorry.
Hello?
Those two rooms right there. Yes. Sorry. If you could share the PowerPoints with us, that would be really appreciated. My question was, and I may have missed this, sorry, whether or not the services apply to people who are undocumented workers.
She said yes.
Okay, thank you.
Yes.
Right.
Yes. I may have missed that in one of the slides, but yes, essentially, we do not ask for any kind of immigration status in any of our intakes. So regardless of immigration status, you are able to use any of our programs.
Awesome. Thank you.
Oh, I have a question, Sandy.
Go right ahead.
Okay. Many of the domestic workers are quote privately employed. So there will be an individual who would hire a cleaner or nanny for their children or someone to care for their elderly, a relative. How is that handled? Because they're not an agency.
Yeah, so that's why we are trying to go to out there and canvassing, such as the parks and libraries that I mentioned, because again, they are not with an agency most of the time. They are privately, like you said, privately employed. So that is one of the things that we are trying to do by going to these meetings, by going out to the parks and libraries to meet them where they're living and where they're working, so that we can tell them that this is happening, that this is a resource that they can do alongside with our other financial empowerment or tax prep or any kind of resources on our agency has. But that is one part that we are trying to do as well, yes, to really reach out to the
So
privately
in other
employed.
words, you're trying to reach out to the worker. And
Mhm.
what about the employer who may not be aware of all these rules?
So that is actually a good question because we do have an organization called Hand in Hand that we partner with that is a primarily employer side. They want to really educate the employers because it is a very private relationship because these people take care of their children. Sometimes they live in their homes, so it's very personal. So we understand that we don't want to make any kind of issues for them because at the end of the day, they're going to be working with them side by
Right.
side. So one of our partner, Hand in Hand, is, they're great because they also do encourage that conversation to be had between the employer and the worker. Because again, we don't want the nannies or whoever the workers are to be unemployed. We want to make sure that they don't get mistreated. That's our mission has always been education first, so that is why we really do appreciate all our partners to
Oh,
helping us out.
okay, thank you.
Right. I don't know if anyone has been reading the chat, but Kay Cardona has been writing. Would you like to speak, Kay? Kay, and say anything? Ms. Cardona?
Sure, thank you so much. I actually had a second thought about attending the meeting tonight, and then I said, no, let me just go for it. Hi, Miss Ravina. I am a certified nurse's aide for 20 years. I got into it with the idea of helping people in their homes. I never wanted to work in a nursing home. I did for 1 week, and it was awful because you have no control over anything. And I'm not saying patients were mistreated, but it didn't feel like there was any kind of humanity involved. They're cared for, but it just was an awful setting. And then I injured my back and I said never again. And I started working in people's homes. Most of my patients have been what they call children of the Depression, who were already in their 70s or 80s at the time, and what was left of the Holocaust survivors. So for the most part, it's been good, but trying to make a living out of it is another thing, like negotiating what the pay is going to be, trying to get the family member of the patient to do some kind of a contract, you know, what days and hours are going to be, trying to negotiate vacations, or, I mean, back in, I think, 2010, I started to get really sick with chronic sinusitis, which I still have because I have 3 autoimmune diseases. And trying to negotiate sick time and get paid for it was just, I mean, it's just, no one seems to understand. You're there. There are times you actually, even if you're not a live-in, you have to live in, because otherwise these people, their families would stick them in facilities. They're not going to stop their lives here in New York. They're not going to stop their lives in other states and other countries to come and care for mom, dad, or whoever. So you have to sometimes make arrangements for your kids so that you can stay with the patient overnight, sometimes for weeks on end. If they're coming out of, if you want them out of a rehab type situation and back in their homes so they can thrive. I mean, people just don't understand what goes into this. It's as if they're your own family member, because that's how you have to treat it when you're working for them. There's a lot of people I've met that have aides, mostly female, not so much the male aides I've met, but female aides that are kind of not as attached as they should be. But for the most part, most of the people I know that do this work or have done this work are very attached to the patients. The patient is a family member to them. And I think the public doesn't seem to realize we're not lower people. We're human beings like anyone else. We go to work like anybody else does. Just because we work in your home doesn't make us any less of a valued working person or member of society. It's just shocking. Some of the things that I've seen happen to people, and myself too. I've had to fight for a lot of things over the years. I'm 20 years in, I'm in my 60s. I'm tired. I don't know how to use a computer. I can drive, but I don't have a driver's license. What work is there for me other than what I'm doing? To retrain, I can't afford to take off. To go to college to find another career. There has to be, when people get into this work, especially those that are middle-aged, if they're coming from another country or they're getting out of a bad marriage or the kids are grown and they want to move on, there has to be a system in place where they can grow, that they're not just stuck working in a nursing home or somebody's house. There has to be a way where they can ease into something else, maybe management or a social worker or some kind of a path to something better, but better paying, less stressful, that's just my thoughts on it.
Thank you so much. Is there anyone else who has any questions?
Thank you.
All right. Thank you.
Thank
So-
you. I see that you're also a member of the National Domestic Workers Alliance, so that is great because they do have many resources for their members, such as contract negotiation, and like you mentioned, it is hard. It is not an easy job by no means. So I appreciate you sharing your thoughts, and if you need anything from me, again, I can certainly you know try to contact you, or if you have any question, please do let me know.
I
Yeah,
thank you so much.
yeah, I'm also a member of National Nurses United. So, because I am a nurse's aide and I come from nurses. So I joined them as well because of the struggles going on in those areas too. So
All right.
anyway, thank you so much.
All right. And thank you both for your insight. Is there anyone else with any other questions for Raina? All right, Raina, so we're going to let you go. And now we'll let the nurses from Jacoby get on, and you could stay or you could leave.
Thank you so much.
Thank
Brenda.
you.
All right, you're welcome. All right, so Miss Rendon, are you ready?
Weldon?
Yes, I am.
Ms. Weldon.
Yes, I'm. So I was just wanted to talk a little bit about the Nurse Family Partnership Program, and just explain. And then I have a colleague of mine who will also speak, and she has a client that would also like to give a testimony as to how effective the program is. But we just wanted to let you know that the Nurse Family Partnership Program is a program that has been at Montefiore, in Montefiore Home Care since October of 2015, and it's being threatened now to be closed down. And we just wanted to bring to the attention of the board and to the community how vital this program is and how much needed it is in the community. And Patty's on?
Yes, I'm on.
Pat-
Can you hear me?
Okay, go ahead. Yes, go
Patty,
ahead.
where
Patty's
are
going
you?
to speak a little bit about it. She's one of
Patty,
the
oh,
NFP nurses.
Patty.
Oh, wait. It's coming up as Patty Torres, so Patty Valenzuela. Okay.
We're good?
We're good. Can you hear me?
Yes.
Yeah.
Okay. Hello, everyone. Thank you for allowing us the time to speak on this amazing program. It's the Montefiore Nurse Family Partnership Program. I'm Patricia Valenzuela, and I'm one of the nurse home visitors. This is a home visiting program, so we go to the client's home or wherever it is feasible to meet with them. I've been working for this program for 13 years total, but 4 have been at Montefiore. The initial 9 years were at VNSNY. This is a program for first-time mothers. We enroll our clients.
Oh,
Wow. Go
Yeah.
right. Oh, I'm
Okay.
sorry. We
No,
were
no,
all
it's okay.
excited.
We enroll our clients by 28 weeks gestation, which is 7 months or earlier. There's a cutoff specifically because it's an evidence-based program. So based on all the studies and testing that have been done, they've come to the conclusion that starting this program by 28 weeks proves to be most effective. They also have to meet low income requirements. So if you are eligible for WIC, food stamps, things of that sort, you would be eligible for this program. So those are pretty much the requirements or the credentials needed to enroll in this program. And during their pregnancy, we focus on many topics. Some of the topics include educating them on how to have a healthy pregnancy, danger signs of pregnancy, letting them know, what's normal and what requires a medical visit or ER visit, preparing them for labor and delivery, the baby's arrival, breastfeeding, and birth control, of course, because that's something that we want to discuss prior to them delivering. Being that they're first time moms, sometimes we have moms as young as 13 years old. I've had a 13-year-old.
Oh, God.
that's awful.
So we want to make sure that this doesn't repeat itself by their postpartum visit. We continue to visit them until the baby turns 2 years old. And
Wow.
during that time, we do a lot of teaching. We help with teaching them how to help their baby meet developmental milestones, some of the activities that they could do to assist babies that may not be meeting milestones, or just things that should be done so they could meet those milestones, safely introducing solids, breastfeeding, of course, just being the first teacher and trying to make them, as best as possible, feel comfortable in this new role. We assess the mom and the baby, not only for medical needs, but also any developmental deficits, mental health necessities, which we know that's like a big thing now. Financial needs, educational needs, and then we make the appropriate community referrals. We meet the client where they are. We encourage them to be the best version of themselves and ideally become economically self-sufficient. So whether that means, assisting them in returning to school or anything that will allow them to just meet whatever goals they want to meet. It's not what we want from them, it's what they want to do in their life. We carry a caseload of about 25 to 30 clients, but at the moment, we're all well below that because we have not enrolled any new clients since May of 2022 due to the uh, apparently the financial hardship and possible closure of the program, which initially was said to be in December of 2022. And after the strike, we agreed, I guess, because of the strike, thankfully, they extended it to December of 2023. Any questions so far?
Patty, it's the first I've heard of this program, which sounds phenomenal to me. But what reasons is Montefiore giving to wanting to stop the program?
Okay, so that's where Vanessa and all of us will chime in. But I just wanted to give my client Jessica, who's actually on, an opportunity to speak. Her baby was being a little fussy, so I don't want to, miss out on this opportunity. So after Jessica speaks, can we then go back to that question?
Okay.
Okay, so I'd like to introduce you guys to one of my current clients. Her name is Jessica. She has a charming 7-month-old baby. And of course, she is concerned about this possible closure because then that would mean that her 2 years that she's expecting would be cut short. So she's just going to say a few words on her experience so far in the Nurse Family Partnership Program. Jessica, if you would please unmute yourself.
Hi, good afternoon. My name is Jessica. I'm currently enrolled in the program and I'm highly grateful for it. I tell Patty this all the time, and sometimes I feel like I'm always like so repetitive about it. Basically, I had some idea of what the program was, because my sister was enrolled in it also. I loved it and I was always like curious, and I would even ask her nurse like questions for when my time came. And I was basically just glad that I was enrolled within that same program. We always expect like to have a good pregnancy, but stuff does happen throughout it and you just never think it's gonna happen to you. Patty has guided me throughout my whole pregnancy, and basically everything that we spoke about, that's how it happened. Unfortunately, I got like gestational diabetes. Then towards the end, I got preeclampsia. I had to get induced, and then I had it's stuff that you don't expect because you always just want everything to go so smooth. But I was basically mentally prepared and had the knowledge because of this program. And as far as all the stuff that I had to prepare myself with, like even help with my meals, like I was having so much trouble because when you're pregnant, you want to eat everything. Like I was struggling through so many things, but basically the way Patty was guiding me through my pregnancy, everything was happening like how it was happening. Like I was telling Patty like, oh, Pitocin, like, oh my God, it's like I'm going through like a little test. Like they're telling me everything and it's fresh in my mind because I'm soaking in everything that you're telling me about. Fast forward to now, my son is 8 months, and literally it just feels good to have someone that you're able to run to, like, Patty, I don't know what's going on. My son is colicky, my son is not sleeping. And for someone to be able to help you and give you those answers, because again, you're a first time mom, this is all new to you. You don't know what to expect, what's normal, what's not normal. And basically it's very sad to hear that it might be closing because those are the sources that we need. And so this is not something that, how do I explain it? I'm enrolled myself in the second program, being that there might be a chance that this one is closing, and I could honestly say it's not the same. I'm not getting the sources that I'm getting from this program. Come to, like, for example, my son is on, what's it called, on solids. I know there's stuff for me to learn, and they're asking me, what would you like to learn? I don't know what I need to learn. It's new to me. I know there's stuff to learn about, but I don't know what that is. Patty comes to my house and she has stuff, and I'm like, Patty, this is what I wanted to know. What can my son eat from here on? When is he ready to eat this, that? So it's just stuff that you like, the source is there, and I just feel like it's very helpful. So to know that it might be shutting down, it's really like a downfall for me, because now I'm just gonna be like not lost, but I just know I won't have those resources to run to someone and say, Patty, I need help with this. Everything was new to me. Again, this is my first time being a mom, and it was hard. Postpartum depression, just having someone to be able to speak to, or just drive you away from those thoughts for a second, and then say, everything is gonna be fine, you got this, and just having that motivation also. It's something that we all look for, but we don't know that it's there. So to have these kind of programs, it's really a big help.
Thank you so much for your insight, Jessica. All right,
Yes,
now
no
we're gonna go
Can I say something, Sandy?
right ahead.
Should we make a motion to have the community board write a letter of support for this program?
I think it's a great idea.
I second it.
Okay, any discussion?
And now my big question is,
Wait a minute, we
oh,
have to, if we're making a motion, let's do
right,
it.
okay, let's
Okay,
do it.
so we're making a motion. We made the motion. We got it seconded. We discussed it. We have discussed it.
Motion
So the
passes.
motion passes unanimously.
Right.
Okay.
My
right,
question
done.
is, Jessica, was Jessica's obstetrician and gynecologist a member of Montefiore that she learned about the program?
So
Or how?
you don't have to attend Monty clinics to be a part of the program. You can actually refer yourself to this program by calling 311, and they'll connect you to
Oh,
the appropriate nurse family partnership program based on your zip code. So WIC can refer, anybody can refer, but you can also self-refer. However, a lot of our clients do participate in Monty clinics. Some of them even delivered at Monty and New Rochelle.
Oh, okay. Very interesting. All right, now we want to go back to the question that we put on hold to let Jessica speak.
Okay, so to answer your question, so the program, as I said, this is Vanessa Weldon. Okay, the program has been in effect since October of 2015. As Patty informed, as of May of 2022, they were instructed to stop taking on new clients onto the program, new patients onto the program. So when Neisner was brought to Neisner attention, and when we went in as, the union for the nurses, to find out what was going on with the program, because what they wanted to do, like Patty said, is December, they wanted to close down the program and displace the nurses. And we was like, no, wait up, we need to know exactly what is going on. And they informed us that it's a grant funded program, and that they just didn't have enough funding. They weren't getting any more funding, additional funding. But what we found out is that it's always been set up as a grant program. Montefiore always had a portion to pay into the program to keep the program funded. So what we found out during negotiations when we brought it to the table is that Montefiore was portion to pay is $800,000 for the year. Montefiore no longer wants to foot that bill. They're saying that it's too expensive, and it's just not a money making program. So basically, what they're doing is putting profit before patients, because they're
Absolutely.
saying it's not profitable, but it was never meant to be profitable. It was meant to be a social and a preventive program. And it's always been set up that way. Montefiore knew going in that they were not going to be making a profit from it. So to say now that this program is no longer valued because it's not profitable is just absurd, because we see how effective the program is, and we see how much it's needed in our community. And to be truthful, for Montefiore to be claim themselves as a baby friendly hospital, to claim themselves as providing so much more for the community, and knowing that this population that they're serving is has the worst maternal and infant mortality,
We lost.
and it's mainly among the Black and brown people. And this program serves most low income mothers and babies. So I mean, I think and that's why we're coming to the community, to bring it to the community, to let the community know that this is what's going on. Because what we're finding out is that mothers are turning up to the emergency room in preeclampsia and stroking out
Mm-hmm.
because they don't have the nurses. They're not taking on these referrals, which is also a preventive program, because a lot of times the nurses go in, like you see Jessica stated that she was in preeclampsia. She had a nurse in there who was able to diagnose, not diagnosis, but communicate with the doctor to let the doctor know, yes, she has preeclampsia. This is what her blood pressure is today. Maybe the medication is not working today. She's a gestational diabetic. This is what her blood glucose is today. Do we need to adjust the medication or whatever have you? But they have that support in the home. And when they don't have that support, what we find out is that they end up in emergency rooms. And what happens is that they're having strokes, and you having mothers who are dying, young women who are dying, when this is all preventive. And you can't say that it's a matter of finances. It's a matter of revenue, because we know $800,000 is a small bit for Montefiore to foot.
Right, it's a drop in the bucket,
Drop in the
absolutely.
bucket, exactly.
It's,
And
it's
it's really, really, I mean, when you think about it, it just really, it's so very upsetting and blows your mind that they would say that they can't afford $800,000.
well, their profits. I
But
mean, it's crazy because when a patient strokes or die,
exactly,
that has a big cost for the hospital.
of
So the
course,
prevention actually increases their profit if they're going to think
exactly,
that way. It's
Right,
crazy.
and look at what other services that they're offering, from birth
right.
control to
Mhm.
this to that. So it's helping everyone.
Everyone. Exactly. Everyone is helping everyone. And like, Patty was saying, it's a social
Yeah.
economic program where it helps move these patients, these clients, from being on, welfare, helps them
True.
get into social programs, help them go back to school. It helps move them off of this program. I mean, to be more beneficial, I say, to provide more in society, and also to, then they learn to teach their children that. And when you teach a mother, you teach a community, because the mother will teach a community. When she teaches her children, it goes back into the community. So I mean, this program is so needed. And
Um, do you think you can provide us with, just in terms of writing a letter of support? I think it would be helpful for us to have a certain, some numbers, that we can say, this program has served X number of clients over the
You
last,
can do that.
year, two
right,
years, whatever. And I think also we need to kind of lean heavily on the issue of, decreasing maternal mortality, neonatal
exactly,
outcomes, because I work in a hospital.
right,
I, I, we refer patients to Nurse Family Partnership all the time, and it's been
right.
such a godsend for our patients. And so, yeah, I think we need
Yeah,
to definitely focus on the.
exactly. What numbers I can give you is that within the last year, where there has been 175 to 200 clients on program, because they have stopped taking patients onto the program and told the nurses who are the NFP nurses to start discharging their patients off of the program. It's down to 58 patients. But yet they say that they're going to be actively working with NISNA to acquire funding, but yet they have yet to meet with us.
Right.
And each time that we ask them to meet, they give us, they postpone it or whatever have you. So they're phasing the program out. So what they're trying to do is say that, oh, once we get down to zero, well, there's no patients on here. So what are we, what are
Right.
we meeting
Oh
Right.
for?
God.
Right. Is this I have a question. Is this program in other hospitals besides
Yes.
Montreal?
Well, it's New York City. It's through the New
Citywide
York City,
program?
but Montefiore's program was, because Montefiore served the Bronx and the Lower Westchester, Yonkers, which there's not an NFP program in Yonkers. So once Montefiore closes its doors, if they close their doors, if we allow them to close their doors, then there won't be any NFP program to service the Lower Westchester, which is Yonkers. And for the majority, is a lot of areas, I believe, in the Bronx that VNS does not service. Is that correct, Patty?
No, they service all of the Bronx
They
now.
service all of the
Yeah.
Bronx.
Yeah.
Okay.
But the reality is they have there's so many moms in need that they cannot take on all of, the clients in the Bronx. And well, we definitely have a need for it, and especially being that we're at Montefiore, the doctors communicate directly, with us, and then we also have access to their medical care
Right.
based on the computer, right? The
Through Epic, right there.
right through
Right.
Epic, right? So it's just something that a lot of the Montefiore clients will get lost in the cracks and will not be serviced, will be missed. So that's the sad part.
Right.
Yeah.
And
Yeah.
as it is, my understanding is that VNS is also having a hard time accessing Montefiore patients and to get clients from Montefiore as it is. So if they're having a hard time getting clients, getting the providers who I guess maybe are so used to sending their referrals to Montefiore and they're not sending them to VNS or there's some sort of clause. We're not sure on this, but we've heard and we're trying to find out more information if there's a clause that was set up within the Montefiore NFP program where Montefiore doctors could only send to the Montefiore NFP program and not outside of the program. Then that is also an issue because then now you have cornered these patients and there's nowhere for these patients to go.
We have questions from Malcolm
Yeah.
Tamara.
All right. Yes. Malcolm, you have a question?
Yeah, well, it's not really a question, but are you guys trying to get like more funding to that program for Monty or
Well,
advocate?
what we do understand, Malcolm, is that the funding has come through because the funding comes through McBee. The funding is a state and it comes through the state. The state has passed the funding for the NFP program. So what we're asking Montefiore is to show us why they're not getting funding, which they have yet to do. So we don't know if Montefiore was given some funding and then they just chose to use it elsewhere, or we don't exactly know all the answers, and that's what we're trying to find out, and that's why we're trying to ask the community boards to help us find out, because Montefiore is not being, we feel, all the way truthful, and they're very evasive about it.
Well, money
Well,
is given for
Right.
one specific program, and it's not being used for that program. That's misdirected funds, which of
Right.
course is illegal.
yeah.
Right.
Well, I'm technically an employee of Montefiore. um, I actually sat through a meeting earlier this year, where I know there was a group that had a maternal health expo. And I know that there was working towards increasing advocacy and awareness for some of the resources that Montefiore had in regards to maternal care. I can give you that connection on their email so you can speak with them. I know that
Okay.
they will love to be able to speak to the community and to better understand what your concerns are and possibly work with you, because I know that
Okay.
during their health expo they did bring in like some startups and other community organizations that that do aid in maternal health. I know one of them was called My Lua Health, which was like a virtual app that helped pregnant women, especially women of color, track their symptoms and have better communication with their healthcare providers. So I can share that contact with you.
Okay. That would be
They'd be
great if
happy
you
to
That
could
would
put
be
it in the
great.
chat. Mhm.
Okay.
Malcolm,
Okay.
you mentioned, a program online, but they may not have access to
That's
a
true.
computer.
It's true. But
Exactly.
I'm pretty sure my colleague would definitely be able to speak to you
Okay,
and
that would be
help
Right.
you
great.
guys out.
That would
Because,
be
and
great.
the other question that we have, because we know that being that it's a grant funded program, the grant has to be renewed every 3 years, every 3 to 5 years. So we're wondering, and we've asked, and we have not got a definitive answer as to if Montefiore reapplied for the grant in time, or did they miss it? And is
Oh,
this the reason why they're not getting funding? But they won't say that they missed it or they didn't do it, because if they did miss it, then I mean, that's
Well,
on them, and it looks so bad upon them. So,
the person in charge. Are they
right,
going to say during the pandemic, we weren't in the office?
right.
They're going to use that as an excuse. So then why can't the deadline be extended?
Right, exactly. And if that's the case, if you did miss the deadline, can you reapply for the upcoming deadline? Can
Right.
you reapply to it? So instead of just closing out the program, because what we did find out, because the funding we do know comes through McVie, and what we did find out is that the less clients you have on the program, the less funding you get. So
Right.
if you maintain between the census for each nurse between 25 and 30, which McVie requires, then you get the funding. So by them not taking on any clients, they're going to get decreased funding anyhow. So these are all the things that are in play here and that we're asking for answers for, and we have yet to get any answers for.
Yeah, someone goofed up somewhere. All right, Tamara, you have your hand raised.
Hi, my name is Tamara Guerrero. Can you hear me?
Yes. I do.
Sorry, my name is Tamara Guerrero.
We can hear you, Tamara.
Okay, I'm one of the nurse home visitors as well with the Montefiore NFP program. I just wanted to touch base a little bit on some of the things that were said. Sorry if I was late, I was at my son's game. So in terms of VNS having this program, so this program is not only, for New York, it's throughout the whole country. So pretty much every state in the US has a nurse family partnership program. The problem with, or the difference, I should say, with Montefiore and VNS has always focused on the government hospitals. So your Jacobi, your Lincoln, things like that. They were never receiving a ton of referrals from any Montefiore site. I believe there might have been like one or two in the South Bronx, but for the most part, they were just focusing on, Jacobi and other hospitals like that. That's where they had, that's where they had their connections. So Montefiore losing this program, it's a big deal because especially for Uptown Bronx, Montefiore receives most of the maternal patients, the OB patients, with majority of them delivering between 233rd, Wakefield, as well as Einstein. So if they lost this program, they're not going to be servicing a very large population of mothers. Even if VNS was to full capacity, we wouldn't even be making a dent in the amount of patients in the Bronx that needs this program. Also, with us not taking any patients on, so we get McVie funding, but we also get funding from Medicaid. If we don't have a full caseload, that's less patients that you're billing Medicaid for, and again, that's less money that you're bringing into the program. So those was my 2 cents.
Mm-hmm.
It's quite all right. Anyone else with a comment or a question? Joanne, you have a question?
No, I'm good.
Good. Anyone else? I want to say thank you again. You've enlightened me. I never knew there was a program out there that existed for mothers like this, and it's such a great program. So I thank you. Maybe you would like to come and speak at the regular board meeting. You're given 3 minutes to do that.
Okay.
You won't have the time that you have here, but this is being taped and it will go on the internet.
Okay.
Yeah, coming to the full board would be a great idea. Either you come, this coming up, it's kind of close, it's the I believe it's the 23rd, but I'm not sure if it's going to be the 25th actually, but perhaps for June.
Right. So you can, Candace, you have your hand raised.
Yeah, I just wanted to share. I'm Candace. I actually work with and for the nurses at NICE-NAM on staff. And I just wanted, again, thank you all for listening. This is a really important program to all of us. So you guys making a motion right in the moment to support is like very, makes our hearts burst a little bit. We know that this is going to be a long haul, and we just want to make sure that we find a way to sort of put some pressure on making sure that Montefiore doesn't fail the community, seeing as they are the largest employer, largest hospital, largest everything in the Bronx. And so, yeah, it really, I think what we want to do is continue to build a campaign of support from the community to make sure that the community doesn't lose this program. So, yeah, I just wanted to thank you. And we would love to come back. If it's possible to come back this upcoming board meeting, that would be great if there's any room on your calendar, but
There
if
should
not, for
be.
sure in
Yeah.
June.
There should
It,
be.
it should
Okay.
be May 25th. Usually it's the fourth Thursday of the month, but
Okay.
it's subject to change at times.
And
due
it's
to
in
holidays.
person, right? Or is it virtual
Yeah, it's in
also?
person. It's
Oh,
actually
nice.
it's hybrid.
Okay.
So
Okay,
if you
that's good.
wanted to,
Mhm.
if you couldn't attend, you could still attend.
Okay,
If
that's
you couldn't
great.
attend in person.
Then you could do,
Also, have you contacted other community boards as well?
Last week we were at Community Board 10.
Okay.
that's great.
Community
Yeah.
Board 7 was canceled this evening, but which is good because it conflicted with yours. But we do want to start kind of hitting each community
Right.
board in the community because the Bronx has many, but we know that the main catchment CBs for Montefiore in particular are CB 10, 11, and 7. But either way, as Tamara had said, there's a large area that they cover in the NFP program that actually probably goes beyond CB 10, 11, and 7. But we do want to garner as much support as possible and to make sure that, Montefiore doesn't, allow this to drop. That, it may not be a moneymaker, but it will help get the Bronx up from the bottom 62 health indicators of the
Exactly.
62 counties of all of this of the
Right.
state.
I know, we're right at the
we've been
bottom.
for
Right.
years. We can't even get up one notch. So
Disgusting.
yeah,
You know
it's
what
very
I'm wondering
telling.
also is to talk to your city council members
Mhm.
because this benefits,
Yeah.
Yes.
the city, and it helps in so many ways.
Yeah,
Absolutely.
That's
we have
just
been in
another
touch
thought.
with the council members as well. We reached
good.
out to many of them, so we are actively trying to keep this program afloat by
So
all
it's a
means
state
necessary.
program? Sorry to interrupt, but
National.
this is a state. No, I'm saying, is it state funding that Monty is matching?
Well,
Is it state
Medicaid would
funding?
be state and
No,
city.
I'm saying that you explained earlier that
They
the
get
state
they get
gives
funds.
money.
Right. Because they were waiting for the state budget to come in. They were waiting for Sunday. So the state does contribute a portion to it.
Okay.
And then Montefiore is supposed to match, well, not to say match it, but whichever portion that's left, Montefiore is to cover it. Was supposed to
Right.
cover.
So then you could
Yes.
speak to your assembly person
Then
Right.
for the various community boards and
Yes.
the various areas of districts, and they are active with the budget. Maybe they can help as well.
right, the
Right.
state senate for Community Board 11 or part of it
State Senate, the state
is
assemblyman.
Natalia Fernandez.
Right.
Yes.
Yeah, I feel like we have
We have.
our
Right.
approach is multifaceted because at the
Okay,
end of the
great.
day, the assembly
Yeah.
members speak, they answer to their constituents. So we also want to make sure that the community
Right.
knows
Right.
how to push
Yes.
as well. So yeah,
Right.
we're very
Okay.
much so trying to all angles.
Hmm.
But we
Very
really
good.
appreciate
Thank you
your
so much
time.
again, everyone. So
Thank
I'm
you.
going to say that the meeting ended at what,
Oh, and
8:01?
is there any way?
is it-
I know that Malcolm wanted to give us a contact, and Cynthia also wanted to numbers. Is there a email that you
So
could put in so we
you
can?
can check Sandy at the
Ye-
community board, and then
Okay.
she'll make sure that we
Right.
get it.
Okay. Great.
Right.
And
Okay.
I could email Sandy and give you the
Okay,
contact.
you
Okay.
right.
Great.
And then I
Thank you.
will send it to Vanessa
Yeah.
or whatever.
Van-
We'll work it out.
Vanessa
Vanessa, I
Weldon or
think
and
I have your
Candace
email
and
address.
Candace Hearing. Yes. Okay. Thank you so much. I
Thank you.
appreciate
Thank
it.
you.
And I really
Thank
thank you
you.
for having us
Have a great
Thank
night.
you.
and
Have a
listening
good
to our
evening.
plea. Thank
Good
you.
evening.
Thank you.
Okay.
Alrighty.
Good
Thank
night,
you.
Good
everyone.
night.
Thank you.
Okay.
Any
Bye-bye.
new
Night, thank you.
for the
8:02.
committee members? Any new business, old business?
Mm,
I'm always trying to figure out how to leave. I'm sorry.
I don't know either. There's an exit on the
I think the
lower,
red X.
the
Check
red
out the
X.
red X. There's a red
Right.
X on mine anyway.
Yeah, that's what
And
I
then
have.
leave comes up. There you
You know,
go. See?
I cannot believe there were two great programs, and I had no idea that they existed.
They're fabulous. I mean,
They're
but
Right.
they're getting rid of the patients. They're asking the nurses to discharge the patients. That's a
That's
sin.
absurd. You know, it's
Yeah.
all about money. And I mean, Montefiore has so much to throw around.
Well, it's
for
all
other-
about playing with statistics too, which,
Yeah.
you know, liars statistic, you know, liars statistics are liars, are lies, and liars make
You
statistics.
could skew those numbers any way you want.
Right.
And we know that.
Right.
All right. So I say to everyone, it's been a good
Okay.
meeting, and everyone have a great weekend ahead.
Thank
Okay.
you.
You're
Thank you.
great.
Bye-bye.
See you all. Bye.
Bye-bye.
Bye-bye.
Did anybody call Jeremy?
Oh, uh-oh. No, I didn't have my phone near me.
All right.
Normally I do.
I'll shoot him a text.
Oh, wonderful. All right, thanks.
All right, bye.
Okay. All right, bye. Well, maybe we'll wait until he.
Yeah, let me see. All right, let me just, I know I
I'm a co-host. I can hit no record, but I don't know. He needs to know.
You should be turning it off. Night, Joanne.
Good night. Take care now.
Bye.
Bye. Come on, what are you doing here? Leave me.